Good morning, everyone, and welcome to yet another webinar in a series of Pockets of the Future. And today we are going to talk about collaboration and partnerships as part of our journey in the Nordics, to talk about different frameworks and platforms on how to proceed towards health in 2030. We have three speakers today. Carsten Noble has an active camera on already, and also Anders Tuno Hansen of the Nordic Interoperability, and Jana Sinipuro of the Citra Innovation Fund in Finland. But first off, I'd like to ask, I've been listening in on the Nordic Health Pockets of the Future this week. I know that quite a few of you have done so also, but today we also have Bogi with us. And Bogi of the Copenhagen Institute for Future Studies was part of the very first process that led us to the Nordic Health 2030 movement, where it is today. So Bogi, tell me a little bit about the initial idea. How do you start such a journey?
Yeah, so actually the start went back to a bigger process we did in Denmark in 2017 on trying to align on with the Danish biggest actor, what is really the challenge of health and how can we work together on that. And that was based on that I went through all the visionary documents from each of these, and it showed that even if it looked like they were working in the same direction, it clearly showed that there was too much collision in the path. But one of those conclusions was that working with data, working with digital structures, and working with the new biology, and working with these bigger questions, a small country can't do it alone. And then the conclusion was this has to be Nordic, and then that led to establishing this idea of working Nordic, where we really had to focus on how can we work together on the Nordic, making a Nordic way both for ourselves. So this is both about what is the Nordic welfare state 2.0 when it's digitized in the area of health. How can we fulfill the Prime Minister agreement between the Nordic countries of being the most integrated region in the world by doing this in the health area? But also a slight irritation from my side on going to a lot of personal health conferences where the Nordic countries always were presenting, Finland, Sweden, Norway, Denmark, on how they were world champions individually. So trying to join the forces, and the drive here is to, there are so many good forces here, and we probably have the best option in the world to try to work together on these things and make a function out of the rich data we have in the societies, the trust that we have in the societies, that we already have single identification and single payer system, but also a digital identification that makes it possible to work. And then with the new different ways of working with data with federated systems, we don't even need to discuss anymore if there should be one big biobank in Helsinki or in Copenhagen. We just need to figure out, can we benefit from working together? And then this could only be realized because there is a lot of people, including you, who really were already thinking in this ways, and we joined forces and pushed it together forward.
Thank you, Bogi. But then I guess without further ado, I'll give the floor to our first speaker, Carsten Noble of the University of Aarhus, and a presentation about how to utilize ancient way of collaborating in the Nordics, but in a new and different setting.
Yes, I'm happy to be here and to be able to present this work we've been doing in Denmark for quite a while, because we have been challenged by some of the things that Bogi mentioned. Lars and Bogi is also part of this discussion here. So I'm going to present something called a 1P4 IDE, which is something in English actually, but it's also something in Danish. But the whole idea is here, should we do things differently in the future in order to unfold the potential of the Nordic health data, as Bogi has mentioned. And to the left here, you can see the P4 unit that is actually the essential for getting all data machines to work. This is actually where it gets all its power from. So this is called a P4 unit. The burning platform is that we have a demographic development and a technological development, and talking about the demographic development actually will lead us to a point where personal medicine and biological medicine with kind of take all the costs from the we have in our society to put into treatment of disease, and very much in line with the Nordic 2030 health movement of the 5-5 aspiration. We need to look in another way to try to find another way, like more a preventive approach, a proactive approach to this area. This is also where we think that the potential for the Nordic countries are. The two pictures on the right are here in Danish, and the lower one actually emphasizes that if we have let the tech giants move on, we will have inequality in health. And on the other hand, the windmill adventure that Denmark experienced when we kind of invested in green energy might be something to inspire us within this field. If you look at the situation right now, you know, there's been a lot of focus on wet data and enormous amount of data, nanotechnology, the omics going into the wet innovation. But looking at the development here, we are increasingly developing so much data around ourselves that we need to handle that in a decent way. And at this point, we just collect data, but we really don't get enough value out of it. Of course, we get value out of the gadgets we have, but how do we link this to our life and qualify our life? This is a major challenge, and this just shows overall the enormous amount of data that we're building up every day, and of course, is increasing according to Moore's law. So looking at the innovation we're talking about here, here's an overview of the patents development within the area of AI. And this is just AI, I know this is just an example, but you can see here Sweden is actually somewhere in this picture. You can see in the, it's a dark blue here, but if you look at the, you know, the top scores, of course, it's China and the United States. And you can see here, this point around 2016, 2018, China will kind of pass through, leave US behind. And I don't know about the election in the US, but apparently we'll see an interesting development, a little bit depending maybe of who's actually taking the president place at the role at this point. But still, the Nordic countries, the question is, what are our role in this future development? So the question is, could we provide a new area, a blue ocean for the Nordics? And I used, you know, the Health 2030 nice picture from our collaboration, and also the windmills in the big ocean as a picture here. So I think we need to go for a Nordic Population Lab as a blue ocean of the Nordics. And the question is, of course, as Bogi mentioned, a lot of people have been talking about this, but why haven't we unfolded this potential? So why this initiative? Just going here. This is one. We moved to a story here, actually, which kind of signifies why we should do this. It's called a true story. It's actually a Verily story. It was at a Nordic conference a few years ago where I met a guy called Patrick who worked for Verily, which is one of the, you know, one of the companies below Alphabet who owns Google. And one of the reasons why he was interested in talking to me is that what I'm showing up here is that they can bring a lot of things together, but they actually need the partnership with the citizen and the confidence of the citizen in order to unfold the whole potential of linking ground truth data with 24/7 data. So it led us to, over time, the group here also building on these scenario process that Bogi has arranged, that we thought we need to have a vision to unfold the potential of the Nordic countries and maybe try to take another step. Instead of having a focus on research and public aspects, then actually going for common denominator being the citizen value creation. Very much in line with our way of looking at things here. So what's common here in the Nordic environment, we would like to create synergies between dry and wet research and innovation. Today, the investment has primarily been in wet innovation. And how do we actually put the same framework up for dry innovation? That means data innovation. How do we secure the convergence of data learning, and how do we secure the perspective of Nordic citizen? And again, we need to be neutral when it comes to stakeholders. I think that's really important, and that's actually a mission in itself. So is there a third way? We have the American model, we have the Chinese model, but how about the Nordic model? Should we go for market model, governmental model, citizen-centered model, private data banking, national data banking, or endless data banking? That means cooperative data banking. So it could be a new Nordic growth model, which is not economic, but eco-economic. That means that it's a population test lab based on the full value creation, actually brings together the omics, including the sociomics, and maybe the sociomics as a primary thing, and then focusing on new areas such as phase 0 and phase 5, referring to the classical phase 1 to 4 of testing life science products, where we actually focus on the primary prevention, where we have the best benefits for really moving health or making personalized health. And then phase 5 saying, when you get into treatment, how's actually a daily life and how long should you be treated? And we have a number of examples that actually treatment might not be those that should be done over time to your death, but actually should be modified during your life course. And nobody actually has a focus on this area. So the question is, how do we develop wisdom of the clouds? That means, how do we separate the kind of the confidence between those who actually work directly with the citizen and the learning algorithm? So we put up this kind of picture of saying we have to have a confident cloud and an analytic cloud with high security, and these has to be totally separated. This is a kind of a challenge to do this, but actually it matches the whole legal approach we have in Europe. So going back to why we call it EN, that's establishment of a Nordic, where we start with Denmark as a model, as the first place to start, because we are in Denmark, those of us working here, and then actually moving on to the Nordic country as a propel to move off this windmill in the air. And I'm just mentioning Folkesundhed.dk, which is something we're doing right now, is actually to emphasize on the empowerment and the empathics of the population, actually including the diversity of public health here. And this is the starting point. But moving on to the Nordic, it'll be interesting to move it up because we have similar cultures and infrastructure, and actually going for a Nordic perspective to move up this windmill in the air. So this is just a vision of how we establish a Nordic starting point. The citizen-driven P4 perspective, maybe you all know the notion of P4 medicine. I don't have to explain that further, but the P4 solution will be primary health, population approach, N of 1 methods, the platform model, and the patchwork collaboration. And this because we don't need to build new platforms. We have to build an environment upon the platforms we have, and I'll come back to that. So this is inspired by a Danish company who had a business model done for making games. It's called the Unity platform. And here you actually have a very smart way of building environment on top of all kind of tools and data plugins. So this could be inspiring for how we develop a model. But the most important thing that I will stop as my last part here will be how we governance-wise do this. At least in Denmark, and I think we have examples in all the Nordic countries, we have the cooperative movement, who actually was how we started out as a top picture to have synergies between people who are producing milk. They have a cow, they have 10 cows, they have 100 cows, but how did they reach the level of high quality, got it homogenized into the factory, sold as good products? And I think we can be inspired by that approach, because we have here a very obvious way of doing things this way, because different data owners across the Nordic countries. So I put up a number of arguments here for this kind of solution that we could think about and discuss. So ending up with something interesting, I think, just to put it in perspective, if you look back in history to 1919, in Denmark we saw this very interesting series called Berlin Babylon right now, where you look back and say at Industry 2.0 we actually have the development of Bauhaus, and could we think about Health 2.7 as a place in 2020 where we have to step back and look at new ways of using this, and not just looking at the traditional model. We really have to do innovation here, but basically the focus is the same: sustainability by design, aesthetic functionalism and value creation in everyday life. Same focus as the Bauhaus movement. So maybe also because European Union actually points to a new Bauhaus movement, I think this is something we should be looking at as a timing thing. Thank you.
Thank you, Carsten. So right now I'll give the floor to Anders Thunol Hansen.
Okay, I wanted to use this opportunity to present a partnership, a collaboration that has been initiated in the Nordics, and describe to you a little bit about what we are doing in this project, but also to end up with summing up some of the experiences that I have being the project leader for this project for 2 years. And my name is Anders Thunol Hansen, and my background is marketing communication. So by coincidence, my career led me to be ending up as the marketing manager for Tieto Every for nearly 5-6 years, where I then was the marketing manager for the health and welfare sector. So in that, and for the Nordics. So in that position, I had to learn a bit about the healthcare ecosystem and also, of course, about the IT. And I also led an interoperability project in Norway for a couple of years, where we then showcased how we could share data on a national basis. So when this project came up, I was invited into this as a project manager, and I'll tell you a little bit about what how we have developed this. And the starting point of this project is actually where we have been thousands of times in different kind of meetings where we discussed that sharing of data in the Nordics would be perfect, and it's very easy to agree that that's a wonderful agenda, as we have today, as we have on the agendas today as well. And at the HIMSS conference in Spain 2 years ago, sharing and using of health data, the Nordic reality was on the agenda at that Nordic delegation meeting, as it had been a lot of times. Being in conferences like that, at the Nordic delegation meeting, it's easy to collect a lot of smart heads from the Nordics into one meeting room. And it's then very easy with these smart heads collected together that saying that it would be wonderful if we could share data across the Nordics, and everyone agrees to that. And it's also very easy to say that, well, we are not doing that today, and we're definitely not close to doing that. And everyone agrees to that, and then we can do a workshop coming up with a lot of the ideas of what to do. The biggest challenge is that when those smart people leave that room, they go back to a national, regional, or local agenda. And very few actually have a Nordic agenda. So then nothing much happens until they meet again at another conference with a Nordic agenda, saying that wouldn't it be great if we could share data. So that was the starting point for this project, where then Cambio, Tieto, Olo Health, and Sectra put their heads together and said, let's do something instead of just talking, and let's see if we, through the building of actual showcases, could steer the discussions towards more a practical angle and a more pragmatic angle, where we then focus on how to share the data in kind of real life. So that was the starting point, and then we had to go out and then try to sell in that idea and create a group of Nordic representatives to take part. But one of the things that we started out with was the patient focus. This is Clara, a girl that was living in Stockholm, is living in Stockholm. She was 17 years old when we started. And she's living a very normal life like the rest of us. But the difference between her and many others is that she then is living with diabetes. So what we had as a starting point was that when the others could decide to go for a weekend abroad, just bringing a visa card and a passport, she could do the same, but since she was having a chronic disease, she would have to then plan again to make sure that she had all the necessary medicine, data, etc. With her, so that if anything happened abroad, then she could be safe and sound. Because when she was crossing the national border, her data would be stopping. Now, from a national, local, and regional agenda, we know that we are not sharing data there either. So interoperability on a local or regional or national level is already up to discussions and on very many agendas. What we want to do was also to raise them in parallel the Nordic agenda, so to make sure that someone also got up in the morning and was then having the kind of the Nordic flag on sharing of data. And this is because when it comes to interoperability or sharing of data, for all of us working within the bubble of healthcare, we find a lot of reasons why it's so difficult to share data. And they are probably all valid and reasonable. But the patients and the citizens are not only patients, they are also citizens of the society as such. And they see that in their world, as a citizen, that sensitive data in their world is already being shared. Because as a citizen, you will find that bank data is sensitive, you will find that passenger information is sensitive, and you can see that that is sharing across national borders. But when it comes to your patient data, it stops. So we found when we started this project was that we don't think that citizens will sit still and wait for the Nordic welfare model to come up with something if they don't start doing something, because then someone else would do it for them. And then there would be some Americans or Chinese or Russians or someone else that would give us the opportunity as citizens to be sharing our health data, but on different platforms than the Nordic. So that was kind of the starting point from the patient perspective. So we ended up with saying that we wanted to enable patients to live and act in an open, seamless, cross-border healthcare ecosystem. And we wanted to do that by showcasing and implementing world-class solutions and innovations from the Nordics. So we wanted to use the Nordics, the Nordic-wide scene to be kind of the test bed for good solutions and to highlight them and showcase them and use that as a starting point for discussions and debates on how to move forward. So in this work, we collected then partners from all 5 countries and from different parts of the ecosystem that started out with building the first kind of technical showcase that we showcased in live at the HIMSS conference in Helsinki last year, where we then could tell the story of Alva, our future patient, but actually that she was starting her travel in Stockholm, and we could look at her data in Stockholm on a Swedish system. She would travel to Helsinki. We could then collect her data from the Swedish system. We can add data on an incident in Helsinki. We could enter more data into her patient registry, and we could send her to Denmark and find that the total of information was available. So in real life, we showed how her data could be then traveling across national borders. Now, sharing of data is not just about technology. As we all know, it's about legal issues, it's about operational issues, it's about semantics. So there's a lot of discussions that has to be had on top of that, but we wanted to have a showcase as a starting point for discussions and debates. So this is a picture from the Helsinki showcase, and when presenting that, we wouldn't say that that was the way to share data in the Nordics. We just wanted to say this is one way of sharing data in the Nordics, and actually have a working group of people putting their heads together to work on a practical case on how to do it, not just to write another report. So moving forward, we then ended up with 3 focus areas. One of them was then continue to build on that showcase, develop new versions. We have a physical showcase that we could put into play, but no one is meeting physical anymore, so we are using it for digital purposes now. But we also want to then use that showcase to start debates and discussions and meetings on how to move forward on the sharing of data in the Nordics, to keep sure that the Nordic agenda was always high up. And then, of course, we would like to look into how could this initiative also be focusing on creating enablers for commercial development of the healthcare industry. We were lucky enough to be part of this Nordic Health report, so we are leaning very much towards the findings in that report and the work that Bogi is doing. But we also is leaning a lot towards this report coming out of Norforsk, focusing on the Nordic data commons and the benefit of connecting existing data lakes to kind of have Nordic-wide data for research and innovation purposes. And of course, that report that came this summer, where the first initiative on looking into legal interoperability of sharing of health data that was produced by Nordic Innovation. That kind of, at least, is the first step towards looking into what is allowed to do within today's legislation. and what has to be challenged to make sure that we can share data across national borders as well. And for those of you who know this 2030 report very well, we have taken as inspiration this balanced model where we have the individual on one side, the data in the middle, and the system, the healthcare system, as on the other side. And based on that, we have taken initiative to what we then define as enablers. And one of them is to look into, from the Data Commons report, how is it possible, or is it possible, to connect existing data lakes across national borders to build a first proof of concept on how to connect data. So we are currently working on a proof of concept together with 3 university hospitals, where we look at how we can collect data in a minimized way or synthesized way, so that we can use it for AI training and share our AI model among the Nordic countries. So that's one of the initiatives that we now are currently working on. And the Nordic Patient Data Lake is kind of focusing, in that model, is focusing on data that exists within the system on the one side of that model. It doesn't really touch upon the individual's own efforts to collect data, as we are doing in different apps and Fitbits and whatever. So what we were looking at that was looking at the UK, where they have put in play a system for accreditation of healthcare apps to make kind of a quality stamp on healthcare apps, so that we can guide the individuals not just to go to Google Play or Apple App Store to find whatever app they find is fun, but actually to guide them towards apps that actually have some qualities and have taken into consideration all the laws and regulations internationally about data security and usability and all of those standards, so that we could put up our master library of good healthcare apps where the individual could then access those and start collecting data on something that could be of value to this total picture of the individual versus the system. So that's what we're currently working on. And then, of course, we are looking into how this could benefit the patient in, for instance, a health passport way of thinking. So to sum this kind of 2 years up in Nordic-wide collaboration, which is then the topic for today, is I have to give a lot of kudos to the partners who have been involved formally and informally into this project, because everyone is kind of chipping in for the greater good. We don't have a Nordic kind of authority. It's 5 countries working together. So people have to, even though they have a national agenda, they have to kind of chip in for the greater good for the Nordics. We have been focusing very much on our project on trying to show something instead of just talking. So we are going the way through actually proof of concepts or showcases or something that could be the starting point for discussions. And we are kind of focusing on just do it. There's a lot of opportunities up there that we could kind of take, and we can't spend the next 10 years just discussing. We have to do something. When it comes to what is the challenges of Nordic cooperations and partnerships, I think one of them is the common Nordic agenda and responsibility. Because very few, as I said in the beginning, have a Nordic responsibility. They have a national responsibility, and they have to kind of chip in to be able to kind of say that we also have a Nordic responsibility. We also lack, from our project's point of view, when we started out, we lacked kind of a common goal on where we wanted to be in the 2030. So in our perspective, the Nordic Health 2030 report represents a great picture of where we want to be. But that picture has to be shared by everyone in the ecosystem to make sure that we are all working towards the same picture. And now it's step by step starting to be that I see that more and more part of the ecosystem is pointing towards that picture. And that's good, because then we can have a direction of the work that we're doing in the different initiatives. What I lack from leading a Nordic-wide initiative is also a mapping of the other Nordic initiatives, because there's a lot of good work being done out there, but no one knows about each other. So it's just by kind of coincidence that we kind of touch upon different kind of initiatives. and could actually be working together and help each other moving forward. So some kind of a mapping or identification of the different initiatives would be great. And again, everyone is steered upon their own agendas. So we have to turn this into something where everyone can benefit from this, because yes, they can chip in the beginning, but we also have to see that concrete benefits comes out of these Nordic-wide initiatives. So it's all about showing me the money. That was what I was planning to say today.
Very good, Anders. And again, you are indeed allowed to ask questions via the chat, but you may feel the need to think about all the good input that Anders has given you. And while you think about that, I'll proceed to our next speaker, Jana Sidipuro of Citra. Thank you for your presentation, Anders, and I'm sure that there will be questions about how to well, increase interoperability, not just in the Nordics, but also across other borders in, well, in the world. Jana Sinipuro, ladies and gentlemen, or as she sometimes refers to herself as the Jeanne d'Arc of fair data.
I really like the Carsten's presentation about this Anders model as tools, because I think we should be more aware of those Nordic assets and ways of solving these topics to the data economy. So building on those good solutions we've had in the past and in the history, that's very good. And also this, I very much agree with what Anders said about the missing links, Nordic cohesion, common Nordic agenda. There's lots of mapping work that needs to be done if we want to influence on the European agendas. And my point of view, because when Citra is working with the fair data economy topic at the moment, and it's very much in the center of European health data spaces work, I think the momentum and timing is really great if we can just pool the resources together. So my presentation today is about the promise of fair data economy. Basically a Citra's project that started like 3 years ago when GDPR came into effect in Europe. First, we were thinking more like a consent-based data sharing approach and how we can build around my data, ethical data sharing tools. So we started drafting how we could use GDPR and right to data portability as an enabler for creating human-driven data economy as an alternative to the Chinese and US-based models, company-based models. But then quite soon we realized that actually we are in a very hot topic, and during the Finnish EU presidency, the human-driven data economy was kind of brought into the agendas, not just AI, but also the use of data. So that's why I think that momentum now to provide practical solutions for data sharing is very good, and also this trust-based societies we all are living in is very, very good basis to build these fair data sharing solutions. So fair data economy, fair for individuals, society and companies, that's our response to the European strategy for data that was launched in February this year. I think we all Nordic countries share this high trust on authorities, high trust. We live in a high trust societies. So I think that makes us perfect places, organizations or countries to innovate on this human centricity. And then of course this vast amount of data available from different registers. The practical solutions vary a little bit between the countries, but I think there's so much common we can do also when it comes to the use, better use, more efficient use of those register data, making innovations flow between the countries based on this very structured and good quality data. So there's certainly a good common ground for doing more collaboration. Then earlier this year, in last February, we were addressed, Citra was addressed from the Commission asking if like to coordinate for the joint action towards European health data spaces. So in the EU's data strategy, they identified these high-value data spaces, and we start building the collaboration between the countries. So we just issued our project plan for evaluation 2 weeks ago, with 22 member states and 4 countries like UK. All Nordic countries are present there, or Sweden, Denmark, Finland, and Norway. And we are working on towards creating this common ground for data governance and creating guidelines for this common interpretation for better use of data. So if we can build this Nordic consensus on on the themes that we want to promote, this is also the perfect place to influence and be a spot on when drafting solutions for human-driven and European data economy. So, but then, why is it important to work around the My Data? Why we thought that it was very valuable to be participating on the Nordic Health 2030 vision work? We need to solve this topic. Increasing amount of personal data, and also emphasis changing from professionals to people as the agents for their own health. So both thinking about cost burdens, but also empowering people. We need to solve this somehow. And I think that personally that My Data thinking can give a very good insight, very good ideas on how to solve this, how to empower people to be more active for their own well-being, for their own health, but also on the use of the data. So there's many good things in the Nordic Health Vision, but these are kind of the closest to me, thinking people as a key to preventive health, and also as a primary points of care and as a data collectors. We should be able to integrate data around the individuals. Of course, it's sensitive data, but there also, I like Carsten's idea that it's safe, secure clouds where you integrate data. Not all data needs to be treated equally. There are different categories of data. So start building these larger data sets, either with the consent from individuals or by using other methods. But it's very crucial for the future that we can enable this data gathering, data integration around individuals to create this holistic view. So, and we've done a lot of work around this, and what we are currently working on is how to make companies to think that this responsible data sharing, acting on top of GDPR, is the way to go, because that's the way how we can maintain the trust, even though we use a variety of different data sources. So from the regulation point of view, the current situation with the GDPR, it tells that individuals should be informed, right to access to their data, right for rectification of data, right to erasure of data, personal data. Those are very, very clear, but we still need to have lots of practical interpretation, how to put those basic rights into the action. Then if you move from there and think people, how we engage people, how we make people to understand that they have an active role by using their own data for their own well-being, but also donating their data for the common good. We need to work towards fair data economy. And that's being more clear, more transparent about the use of data, having very easy, intuitive tools to use data, agree, give consent, and also be able to help, ask for help through different measures. So I think what we think this is maybe more for new digital services, but this should apply also for biobanks and those organizations that are using personal data. We need to maintain trust. We need to be able to say why we are collecting data about individuals, and that should be easily understood and communicable. And that's what we are trying to create in our project, in the Fair Data Economy project. Understandable methods and ways to identify fair data services. So we've done many things, and I think this, when we want to emphasize on trust, we need to focus on governance models, people's skills on how they use tools, organizational skills, technology, and also how this data is being shared in those ecosystems. So that's why we've developed in our project a number of different tools, technologies, a rule book defining on how to make data sharing ethical in a multiplayer field. We are going to launch our own testbed for the use case creation later next year, or early next year in March. And then lots of studies, lots of comparison, what we can learn from the telco sector, from finance sector, how we can bring those learnings when defining this new human-driven data economy. And of course, we need to build those skills. We need to build skills at individuals to understand more about, improve their data literacy, but also at the organizations to be more data-driven. And that's where we have different programs with the Finnish government. And we are thinking about how to scale those into Europe. So there's lots of things happening around this, and I think we just need this, what was actually the common agenda and mapping different initiatives. And this is our dream. This is what we are working towards. A live better app where you have the freedom, you know that this is the trustworthy service provider. There's a fair label, like there's a fair trade label, there's a fair label on the digital service, and you know that your GDPR rights are protected, secured, and then you start collecting data with your own consent, saying that, okay, this service provider can use that data coming from my grocery store, from the National Health Archive, and this is my tracking, my wearables data, and I want to have nutrition recommendations. So this is the way where we want to individuals to be able to think about and dream for, and also where we want to help companies to work for and have practical tools creating this kind of services. Adding a little bit on top of the GDPR requirements and basis on the Nordic values, I think there's a great opportunity for us to work a little bit above what's needed and build on the Nordic values. And that's it. Thank you.
As Carsten says, it's interesting to discuss how we take the next step in organizing a next level Nordic collaboration. Yesterday, I had the good fortune of listening in on the digital and data webinar, and also heard about the data lake at the Helsinki University Hospital, for instance, where indeed you have a pocket of the future, and if not a blueprint, then at least a guiding beacon for how such data lakes might be implemented. Because clearly we have an abundance of data. The thing is actually it's connecting them and utilizing them for good in a fair way. But perhaps to respond to Carsten's discussion, practical next steps. I think, Anders, for instance, you are being very practical these days, I guess. Care to comment?
No, I think that I think one of the benefits that I have is that I come from outside the healthcare industry, because it's very easy if you are within the bubble and have been in the bubble for a long time to be kind of blinded by all the challenges of sharing of data. I don't know enough about all the technology stuff. I don't know enough about all the legal aspects to kind of see all the problems. I kind of try to lead my project in a way where we kind of look at the opportunities and be very pragmatic, saying that, okay, but let's do it. So that's kind of what we did with the Data Commons report as well, which is extremely good. but it points towards more reports. It points to a set of reports. What we did was to go through that report in the partner group, and we said, is it possible to do it? And then we talked with some of the university hospitals and said that is it possible to kind of have US partners just to build a first proof of concept of that report? And they said yes, and we talked to technology partners and they said yes, and well, now we're currently trying to do that. That won't be the answer to all questions, but it will be a first proof of concept. It will be some kind of proving to the authorities, to the ecosystem, that it was possible.
So if you will, and perhaps to paraphrase what you've just said, what would you consider to be the chicken and which is the egg?
No, it's difficult to say. There's a good foundation of a lot of good thinkings, a lot of good reports that we build it upon. So it's not in any way to say that that's not needed and necessary, but sometimes you just have to kind of do it, try to do it at least.
Just try.
Let's try.
Yes.
I just wanted to say to Jana, I really like your presentation because the EHAN initiative and the fair data economy is a really great concept, but kind of hard to grasp from the outside. And I think it was so clear and really good presentation we had. So it's really understandable what you want to achieve with that now.
Okay, good to hear. I need to add to this chicken or egg question that my male colleague always said the answer is the rooster. So I don't know if that's the right answer at this question right now, but I think we need to have those because I've talked about this Nordic interoperability project from different angles and also with the technology providers, and I think this authorities also in promoting this kind of cross-country initiatives are quite cautious because there's so different legislation. So we need to find very narrow use case, which is, and I think you succeed with this. The case is good, but I'm just wondering, are there any ways to make it even more acceptable and less risky? Because somehow we need to find that easy, very safe way of showcasing that that's possible, because otherwise I think there are so much legislative issues and because there's no common kind of interpretations for the GDPR, it's very hard for companies also to take risk, or authorities are asking companies not to take risks, maybe.
Absolutely. Yes. Just to make that clear, when we are talking about proof of concept of the data lake, we see that with the modern technology, with the possibility to synthesize the data, we come away from a lot of the legal issues because it's totally anonymized data. It will be usable for research and innovation purposes, but it won't be able to kind of go the way towards personalized medicine because it's not personalized data.
Yeah.
But as long as we can share then synthetic data, we show that sharing of data is possible, and then it's up to the authorities to kind of widen the scope or to change the legislation or what is needed to kind of make it more closer to the patient step by step.
Yes.
Okay.
Yeah, I think first thank you to all of you. It's very interesting, but also showing different parts of this movement that we all are pushing forward. And I think, I mean, I'm just very happy to see that we are pushing this idea and it gets more and more ground in different fields. And I also think that today so Karsten comes with showing a concrete idea based on works that he has been involved in, and some of us others also in several years, and then having a cooperative idea. And unless you have this cross-border case, let's get some of these things done. And Jana with the wider concepts of the fair data, which also brings bridges into EU right away. And I think what we're beginning to see here, which I think becomes very important, apart from all the points that you've made, is value for whom. and why, which is also the Nordic responsibility, because we can actually do some things which are totally impossible in other places. And here I think to go in, I mean, we need this practical things as both Jana and Anna's mentioned now, in order to get the understanding for the next and the next and the next step, knowing it's not the end station. But we also need to have the moonshot clear, saying this let's push it this way. And I must just say I'm very happy with this, but we always need to have this North Star on how do we make better quality of life and well-being during the lifespan for the individual, better public health, and how can we also make a model, the Nordic way, for both Europe and the rest of the world. So thank you, all three of you, and of course Lars, for organizing all of this.
Thank you. I know Bogi has to leave, but there's a few questions that we will try to summarize afterwards. Thank you to the speakers, and I'll try to see if we can sort these questions out. There's the question about if the Nordic initiative is valid for its own citizens, resident aliens alike. Well, yes, technically it would be useful for both. In the Nordics, of course, you have a personal identification number that's unique for the citizens, but resident aliens, human aliens, anyway, are given a similar number, and therefore are also able to transfer those data, at least in the North, in the same manner. Ideally, you would agree, I guess, Jana. Obviously, the point is not for that to be able to be done only in the Nordics. It should be a wider system, of course. And from Mikael Rinetmäki, the value of anonymous data for research, the push for data to be shared for primary use also. Well, indeed, especially in the Nordic Health 2030 movement, data and also, well, health services has to be provided close to the citizens themselves. It's nice to have good things happening in the big institutions, but as close to the primary users as possible. I think if we can make this kind of a voting system, if you nod, Jana, Carsten, and Anders, you agree, and then it's sort of the way that we try to steer through the questions. Are you talking about clinical closure data? My response would be yes. We do not necessarily limit to, in the sense that any type of data, in the sense that it could either be used for research or to be used to develop personalized medicine or similar. Yes, the core concept, I guess, is the words fair and of course the words secure in this sense, so that there is a continued circle of trusts among those participating, and that goes for the private citizens as well as the professionals. It is also about having a real-time roadmap of project and cases that can support each other. From Mina, yeah, I guess that was a voice of support. The HL7 International Patient Access tries to give an answer to this very citizen-centric and IHAN-compatible way, which is a way of greatly simplifying regulatory issues. I think we agree that indeed it does. And one of the key challenges at this point is to make it actionable as much as possible, in what we mentioned before, as close to the citizen as possible, I guess, as well. Carsten says he'd gladly collaborate. Those of you who'd like to connect to Carsten, do take note of his email address. And if you have other questions, of course, you can contact the Nordic Health 20. Oh, Carsten is back. Yes.
I'm still here, but I'm sorry, I didn't understand we were going after 11 o'clock. Sorry.
It's just to make sure that all of these nice, wonderful questions
Yeah.
at the last minute, but that we
Yeah.
try to get them. And yes, the links to the previous webinars of the series, yes, I expect that we'll be able to share the videos Monday, Tuesday next week, both for the Pockets of the Future series and the Expert Feedback series. And we'll, of course, also bundle them with the 5 nice videos from the Copenhagen Institute for Future Studies that we've shared this week. For both Mina, Jan, or Mikhail, who's sharing email addresses, will take note of those. Be aware that you can go on to nordichealth2030.org. You can register as either an ambassador or part of the movement, and that's another way of also connecting us all. And to the comments about the interesting talks today from, well, Bethany and indirectly also from Jana, I'll also thank our speakers and thank you to our final participants. And I'll make sure to share both videos, presentations, and as much other information as I can early next week, and look forward to see you in the future.